A Leicester Health Pharmacy Consortium service proposal. There are currently 3.6 million people in the UK who have been diagnosed with diabetes, with 900,000 more people yet to know they have the condition. It is estimated that around 12.3 million people are at an increased risk of getting type 2 diabetes. Leicester has a high prevalence of diabetes, with 8.9% of people diagnosed, making it one of the top 5 in the country. 23% of children are obese, showing that this issue starts at childhood. 1 in 1,000 deaths are cardiovascular related, of which diabetes is a major factor. A new NHS service is needed in Leicester to tackle this issue. Therefore, we propose DetecT2, a service dedicated to screening, managing and preventing type 2 diabetes within Leicester's population.
The first step is identifying patients who may be at risk of type 2 diabetes using a specified patient criteria. This can be done via flags in patients' medication records, screening by pharmacy staff, and the patient's own interest from promotions. Step 2 involves screening the patients using Q-Diabetes Risk Assessment Tool, which provides patients with a 10-year diabetes risk. Patients with a risk below 5.6% will be provided with personalized lifestyle interventions, whereas patients with a risk of 5.6% or above will be offered an HbA1c test, which gives realistic long-term blood glucose measurements and is more convenient as patients do not require to fast. Those with a result below 48 mmol per mole will be offered targeted lifestyle interventions. Those with a result equal to or above the cutoff point are at a higher risk of developing type 2 diabetes, and therefore a diagnosis is likely, so they will be referred to the GP and signposted to appropriate services such as smoking cessation and health centres to achieve their goal. All patients will be offered an optional follow-up after 6 months with the pharmacy. This is to get patient feedback, review their results, and discuss their progress with their action plan. This will also involve blood pressure measurements and cholesterol checks.
So, what are the benefits of this service? It is estimated that 90% of the population live within a 20-minute walk of a pharmacy. This means that pharmacies offer patients better access to healthcare due to more convenience and longer opening hours than a GP. So with more people coming into the pharmacy, more patients can be identified and screened, leading to more interventions being made in order to prevent type 2 diabetes. This will lead to a decrease in new diabetes cases and decrease hospital admissions from diabetic complications, saving a significant amount of money to the NHS. In particular, the NHS spends almost £1 billion per annum on the diagnosis and treatment of diabetes, giving you a scope on just how much can be saved. Furthermore, this service will decrease GP workload while facilitating better relationships between healthcare providers, allowing for easier and smoother referrals. This will lead to better patient care. Our service will be provided by trained staff who will undergo relevant CPPE modules, familiarise themselves with SOPs and do patient simulations with regular staff appraisals.
To ensure the DetecT2 service will advance successfully, we will employ various promotions across the local area. Posters, leaflets and flyers will be distributed in pharmacies, community centres and GP surgeries, with ads appearing in the newspaper. Through various social media platforms such as Twitter and Facebook, the public will be able to engage with the service. We will partner up with health and wellbeing apps to aid patients in managing their lifestyle. Furthermore, affiliations with charities such as Diabetes UK and local community groups can be used to signpost people to our service.
So why should you consider our proposal?
Unlike other services, we emphasise the importance of diabetes prevention, and we also provide all the support needed to achieve their health goals, with follow-ups to address both health concerns and monitor their progress.
So let's work together to tackle diabetes in Leicester.
With DetecT2,
Diabetes is only a word,
Not a sentence.